Jackson, start with an upper and lower GI gallbladder series. You know, I swear I have seen him somewhere before.
Yeah, I knew a guy with 3 eyes in St. Louis.
She's here.
Ooh, all right. Anyway.
I'm McGregor, Miss Taylor's assistant.
How do you do? Miss Taylor, Dr. Riverside, Chief of Emergency Services, if there's anything I can do to help.
I appreciate your support.
Yeah, very good. Now, we've set up the presidential suite,
We'll require a normal private room.
but then I decided that you'd probably want a normal private room.
Mr. Tranquilli, call 4 East immediately.
Right away, Doctor.
And I'd pulled a few strings and gotten you a suite at the Fairview.
I'll settle for a cot outside Miss Taylor's room.
But we realized you'd probably want to be at Miss Taylor's side 24 hours a day around the clock. Mr. Tranquilli, call housekeeping.
You see, my mother is a woman of the people. No special privileges for any of us.
Of course, I understand. I like to think of myself as a regular Joe.
The intersection and chemotherapy worked for a while, but it was rough.
Yeah, how long since you lost one? 6 months?
8.
I don't know how you feel.
Louis Keeping Jenkins.
I saw him in the gift shop. Is that for me?
Oh, it's a Christmas gift from my Aunt Minnie.
Last Christmas or this Christmas?
Don't you have a busy day?
Oh, yeah, I got a good brush. Will get straight to me.
Well, let's go. Let's keep on the schedule, okay?
Sure thing.
Did Senator's kid arrive?
Yep.
I heard the working diagnosis was fibromuscular hyperplasia. Bypassing the graft?
No. McIntyre gets a kick out of balloon angioplasty. My little specialty, right, Trop?
Pete, good to see you. Everett, this is my friend Peter Jenkins from Los Angeles.
Believe we've met, sir.
Yes. Washington Medical about a year ago. You were up for Big Cheese. Chief of surgery or something, right?
Yeah, well, they were foot dragging. I couldn't wait around.
Incredible place, Trap. And the salaries, expense accounts, extras, all kinds of perks.
Yes, I know. I heard already.
Too many times, huh, Trapper?
You still up for it?
Who knows? They stopped calling, but I stopped calling them because I wasn't particularly interested anymore. I like it here.
Peter?
McIntyre wants a review on the angioplasty. A little brush up on a cadaver, right?
Well, I haven't done one in a few months, you know. Ready whenever you are.
It's been a while since I've done one of those myself.
Well, join us if you have the time.
You wouldn't mind?
Why not? As long as you don't chew gum. Can't stand chewers.
It looks on target.
Yep. Bullseye. Inflate the balloon. Nice and easy. Go to 5 atmospheres. That's it. No big incision, no general anesthetic, no blood transfusions. A day or so, she's up and around. Ain't science grand? What's your hurry?
I'm running a little behind. I've got a meeting.
Go, you pass. Flying colors. Mail the merit patch from the Riviera. Medical conference.
Fine work, John.
Thanks for stopping by.
No problem. I'm glad I don't have his schedule.
Not even time to back the catheter out.
Oh, well, he's done it often enough. You want to do it? Just for the hell of it?
Why not? Have we got time for the whole procedure?
Come on.
Anyway, she was magnificent, but my back's been bugging me ever since. Nothing seems to work.
You ever try one of those gravity gizmos, you know, upside down?
Gates,
Yeah.
the utilization committee has just given me some figures.
You have the slowest turnover rate in this hospital.
Well, maybe I get the sickest patients, Arnold. You ever think of that?
We need the beds. Now, you've got to get your lighter patients out faster.
Just a second here, Arnie. I'm sure with today's cost, Gates isn't keeping people here on a whim. He's one of your best men. He doesn't have to explain himself to you or that committee, right?
Right.
Well, you may have a point. I'll talk to them. Thank you, Everett. Gates?
Bureaucrats, they're always causing trouble.
Mm-hmm.
Even hassling McIntyre, too?
About the contract, yeah.
Must be up for renewal soon, huh?
Well, actually, Trav's been working without one. He's old and expired.
Hey, I like that. I do. Sometimes you have to toss the rule book and just keep going, you know? Hey, later.
Okay. See ya.
Off the record, Dr. McIntyre, is it getting higher?
Only slightly. What is it?
Headache. Could I possibly get more medication?
I've already ordered some.
But it's a stopgap measure, right? I still need the operation.
Well, it's not really an operation. We're just going to take a very tiny tube.
Mr. McGregor explained the procedure to me. Will it take long?
Not very. Nothing to be concerned about.
I'll be right back.
A moment, Doctor.
A short one. I have surgery.
I've been briefed on this procedure, and it sounds like it could be pretty dangerous.
I understand the balloon device could tear her artery.
And with surgery, there's a possibility of infection, and the graft may not work, so there's risk both ways.
I also understand it's been a long time since you've done this.
Would you like to call in another doctor?
I am merely fact-finding, Doctor, examining all the possibilities.
After you've finished with your examining, let me know. Excuse me.
There you are. Simple as it looks.
Great, let me try it.
Yeah, just a second. I want to get some water. How about you?
Sure.
We were talking about McIntyre. Has he have any more relatives?
Well, there's his Aunt Minnie.
Yeah?
Thank you. Yeah, she was just here yesterday, actually. She brought him a gift.
Oh?
She's a little odd. I mean, she's a nice old gal. And he likes her a lot. She lives down in Big Sur. No telephone, no radio, no TV, nothing.
Sounds good to me.
Oh, it is, except when you want to get a hold of her.
John says that you're easy to get a hold of. You're always out there in that RV.
Didn't know he cared.
John has a lot to say about you. Yeah, let's get you going. How tall are you?
5'11".
Okay.
So, what did he say?
Oh, this, that, you know, plus or minus, depending on his mood. He's got all that contract stuff, you know. How's that?
That feels pretty good. Like what?
Oh, don't pay it any mind. I've seen your work. I think you're very tidy.
What, he said I was sloppy?
You know, I don't recall. Lazy, sloppy. Doesn't matter. He's under a lot of pressure.
Well, wait. I'm sure he was joking, you know. I mean, that kind of thing he'd tell me.
You're a good friend of his. Rough, you know, giving a buddy less work.
Wait, he said that?
Maybe he thought you needed a rest. Just waiting for the right time to tell you, you know. Want to try it all the way?
Yeah, sure.
Okay. Okay, hang loose. I gotta go.
JD, where you going?
As the gallbladder series, the IVP. Now, are you still in pain?
There is pain. I am not in it. My body has pain. I am elsewhere.
Uh-huh. Okay, well, unfortunately, medication...
Would mask the symptoms, yes, I know.
Yes, so what I would like to do is bring in a GI man and do a gastroscopy. That's another kind of test.
As you must. I will cure myself before then. But I knew all this. Why have you come?
Oh, just concern. Haven't we met someplace before?
Another time, perhaps. On another plane.
Yeah. Maybe it was on a plane. Okay, well, get some rest.
As you wish. Rest before the test.
And cram before exams. Wait a minute. Rest before the test, cram before exams. Who used to say that? Somebody used to say that all the time. Test, exams. Where was it? School? Was it grade school, college? Harry? Is that you?
I am Govinda.
No, you're not.